Hi there. Next we're going to go over the stretches, the stretch portion that you've done here in the office. These are your static stretches. Now remember, these are to be done after we've already done myofascial release or your self-inhibitory techniques. Now the most common ones we're going to work on that you've either done here in the office are going to be your pec minor stretch, it's going to be your hip flexors, it's going to be your abs, and it's going to be your calves. Now the first one I'm going to demonstrate is the hip flexor stretch. So this is for people with hip pain, back pain. If you're experiencing those things, likely I've checked that off in your homework box. We're going to go over what the form looks like right now. So the first thing you're going to do is find something about this height. We discussed in the office that you can either use a workout bench, a bed, a table, an ottoman, anything that gives you the same simulated motion here. So the first step we're going to do is place this opposite leg up on the table. So what I want to do is make sure that the foot is straight. We're not turning to the outside. We're keeping in line with the body. So we're going to drop this hip forward. The right leg is going to dip down a little bit, and we're going to keep the body upright. So it looks like this. Now we're pressing this hip down. You should feel the hip stretch here. You may feel a little in your back. That's a good thing. Remember, these attach on your spine itself. So the hands come closer to the body. We're going to press down in here like this, looking up and slightly turning to the outside. Holding for about 30 seconds. Okay? Now the right leg, same thing. Leg goes up. Hip goes down, hands come in, body is up and slightly away. Once again, one of the best things for lower back pain. All right, next one we're going to work on is the pec minor. This is for people that are having upper neck pain, pec pain, or shoulder pain. So the first thing to do here is we're going to place the hand against the wall. Hand's going to be rotated externally about 45 degrees, elbow is slightly bent. Okay. The leg closest to the wall will always go forward. So we're going to step right here. Now you're going to start to feel a stretch across the pec here. Go ahead and lean straight in. Once you feel that stretch coming in this direction, we're going to go slightly downward like this. Then you'll feel it underneath also. Now this is going to release the pec minor, and the pec major. We'll hold that for about 30 seconds. So it looks like this. Feels fantastic. Okay, we'll switch sides. Exact same thing the other way. Looks like this. Very simple stretch. Okay. Good. All right, next one's going to be for the cervical spine or neck. So people that are having upper neck pain, people that are having shoulder pain as well, these are going to be the exercises that have been prescribed to you by myself. So we're going to start here. Hook your arm under the chair. All right, now we're going to take 2 fingers. So we're not applying a lot of pressure. We're making sure we're stretching the skin and the external muscles more so than the deep structures. We're going to start here, 45 degrees away, tuck the chin. Hands going to come right here in line, so nose is in line with the elbow. And it looks like this. Remember, we're doing 4 by 4, so you'll hold for 4 seconds there. 1, 2, 3, 4. Come back to neutral, reset the muscle. 1, 2, 3, 4. Reset. 1, 2, 3, 4. 4 times there. Now the lateral stretch is right here. Same thing, but here. 1, 2, 3, 4. Let it go. 1, 2, 3, 4. Let it go. You're doing 4 reps. Once again, we don't hold these stretches as long as we do the other ones because of how sensitive the neck structures are. All right, final stretch that's most commonly prescribed here in the office is going to be the calf stretch. So if you don't have a foam roller, you can use a step or something that simulates that motion around the house. Very simple stretch. It's going to look like this. Leg goes here. We're locking the knee out. The foot's up against here. We're going to raise up on the opposite foot. So say we're stretching our right calf, we're going to raise up on the left foot. Raising the hips in here against the wall. We're going to bring the hips towards the wall, keeping the leg locked and the foot upwards. Right there, you feel a really great calf stretch. Once again, 30 seconds. Switch sides, looks the exact same. Up in here, 30 seconds. So that's a demonstration of the static stretches that we're going to use here in the office at Elite Ortho-Therapy and Sports Medicine.